clinically tentatively. Now, one word about cannabis. I don't know what the situation in Spain is, but in Israel, after cannabis was released for a short while for chronic pain syndromes that are non-malignant, my life became hell because I had like 6,000 telephones every day about patients that wants only cannabis. And now the government has stopped cannabis for use in fibromyalgia. I think that cannabis may have a part in the treatment of fibromyalgia, but we don't have still raw data about it. We have some data, but not raw data. And also, as I see it, it will be like the tip of the pyramid of the drugs that we are going to use after everything else failed. And even then, we should do a psychological screening for these patients because cannabis can be harmful, you know, in terms of psychiatry. So it's too soon to say something about cannabis. I brought it because it's a very hot debate now in the literature about cannabis in chronic pain and fibromyalgia specifically. Now, what about the non-pharmacologic therapies? Here we are talking about many modalities, but those are the three that have strong evidence. One is education, the other one is aerobic exercise, and the third is cognitive behavioral therapy. Now, education seems like a very simple thing, but just a session of a day and a half of education has shown in a couple of studies to improve the fibromyalgia symptoms. So education is very important, especially that the patient realizes what are the goals, that the goals are realistic, and otherwise there will be some hostility between the patient and the physician because maybe the patient has different ideas about what are the goals and the outcomes of the treatment. Aerobic exercise is very important. There is no a drug company representative here, no, in the audience. Because what I say now is the main reason why drug company don't like to invite me. The drug for fibromyalgia is aerobic exercise. They don't like to hear it. But this is the most important component of therapy, even before the drugs. And nothing will help without moderate aerobic exercise. Now, every patient can do exercises, but the first 10 answers that you get from 100 of the patient, I can't do exercise. But then when I explain to them how to do it moderately and to raise the intensity gradually, then everyone can do it. And aerobic exercise is very, very beneficial for fibromyalgia. The other one is psychological interventions like cognitive behavioral therapy. And as you can see here, negative emotions like chronic stress are affecting the amygdala by increasing activity and increasing pain. On the other hand, when you have positive emotions like music, pleasant odors, etc., it inhibits the activity of the amygdala and inhibits pain. Now, you should be careful showing this slide to young people because they think that music is techno and house. Music is not techno and house, guys. It's the Beatles. So we should go to the 60s. Beware. And actually, cognitive behavioral therapy is a program that is designed to teach patients techniques to reduce their symptoms, to increase coping strategies, and to identify and eliminate maladaptive illness behaviors, especially catastrophizing, which is terrible. So this teaches you how to control catastrophizing. And from my experience, the combination of CBT and aerobic exercises are working quite good in many patients. Not all, but in many patients. What about complementary medicine? Now, you should be careful about complementary medicine because if you go to the Google, you'll find like 6,000 different modalities, and you have all kinds of sources and prophets who are treating fibromyalgia, but different things. So there is some evidence for acupuncture. Some studies have done that acupuncture can be, you know this elephant, guys? It's not the elephant from the beginning of the talk. It's a mammoth, actually. Anyway, some studies have shown that acupuncture can be beneficial in fibromyalgia. And the latest hot stuff is this, Tai Chi. And there is this study that was published 6 or 7 months ago in New England Journal of Medicine. I had to say it, but I would like to pay to get a paper into New England Journal of Medicine. And from all the beautiful studies that we have shown today and others about what happened in the brain, genetics, etc., this is the study that got into the New England. There is a politics, of course, behind it. We are not going to discuss it now. But anyway, they showed that Tai Chi can be helpful for fibromyalgia. So I send people to Tai Chi now. What can we do? So just to summarize this, we have the symptoms of fibromyalgia. We have the functional consequences of these symptoms, like increased distress, isolation, poor sleep, maladaptive illness behaviors. So we have to treat these patients. We have to treat the symptoms with the drugs, and we have to treat the consequences, the functional consequences of these symptoms by non-pharmacological therapies to address this function. I forgot to tell you that I'm using, and it will be interesting to hear afterwards other rheumatologists, I'm using in tough cases also combination therapy. We don't have still the studies. For instance, I have patients who are on pregabalin and on duloxetine at the same time. I'm not sure that combination therapy is more beneficial because we don't have the data, but I have the feeling that it's beneficial. But feeling is not data, scientific data in medicine. This is a scheme that we published 2 or 3 years ago showing how you face the patient in the clinic. And as we said in the first step, you educate the patient about the goals of the treatment, what is fibromyalgia, you describe the condition, etc. Then in step 2, you have pharmacologic treatment, which can be monotherapy or combination therapy, as we just mentioned now. And then you have in step 3, non-pharmacological treatments, like exercise, stretching, aerobic conditioning, CBT, psychotherapy. And in step 4, which is usually chosen by the patient, there are some additional modalities like acupuncture and other complementary medicines. This is just one slide to show you that this field of drugs in fibromyalgia is very hot now. And there are many, many different drugs that are in different phases of research. And you can see that we are going to see in the next couple of years GHB receptor agonist, opioid receptor antagonist, new dopamine agonists, new anticonvulsants, NMDA antagonists. We heard about NMDA antagonists, synthetic cannabinoids, growth hormone secretagogue, and NK1 antagonists. So we are going to see a lot of action in the field of fibromyalgia in terms of drugs and drug companies. I would like to summarize my talk by 2 slides. This is the first slide. Unfortunately, many of us who treat patients with fibromyalgia treat them like this guy, which is a one-man band. And this is the proper way to treat fibromyalgia. In centers, when you have all facilities near you, like hydrotherapy, aerobic exercise treatment, CBT, etc. And then the conductor here is the doctor who takes care of fibromyalgia patients. By the way, it shouldn't be necessarily a rheumatologist, but it should be an empathic doctor who knows about fibromyalgia. It can be a neurologist, it can be a pain specialist, etc. And the last slide is this. William Osler was the greatest physician in the 19th century. And even William Osler was quoted in one of his memoir writing, "When I see a patient suffering from arthritis coming in the front door, I feel like escaping through the back door." So even him, he didn't want to treat patients with pain. And this is unfortunately some of the attitude of many of our colleagues. So we wrote a couple of years ago this editorial, me and my colleague Kobe Eblin, and the title was, "It's time to close Osler's back door." So it's time to take care of these patients. And the last slide is this. This is the really last slide. Don't be stressed, Pedro. And I think this is a wonderful say by Primo Levi. Primo Levi was a famous Italian writer, a Nobel Prize winner, and unfortunately he committed suicide in the end of his days because of depression due to his to staying in the Holocaust in a concentration camp. So he had depression. And he said this wonderful saying: if we know that pain and suffering can be alleviated and we do nothing about it, we ourselves are tormentors. And I feel that this is the most important slide in all my talk. Thank you very much.